With more screen usage and indoor time, myopia, also known as nearsightedness, is increasing and getting worse in children. Now, certified eye doctors can prescribe MiSight One Day, the first and only FDA-approved soft contact lens to slow myopia progression in age-appropriate children. Visit CooperVision.com to find a Brilliant Futures certified eye doctor near you. Do your patients know what presbyopia is?
There are people who are afraid of the press.
Have you talked to your patients about multifocal contact lenses?
I've heard the bifocal, but not multifocal.
Exactly, not multifocal.
Do you need help with your multifocal strategy? Learn more at the conclusion of this episode.
Your eyes and your vision are under attack. Damaging blue light from the sun, your phone, your computer, your tablet, even light bulbs and car headlights is constantly bombarding you. The good news is our eyes actually already have a line of defense to counter the effects of blue light. This defense is made up of 3 pigments called carotenoids. MacuHealth with MicroMicelle, the only supplement with the exclusive patent on all 3 macular carotenoids and MicroMicelle technology.
MacuHealth, your science-born and tested solutions for visual performance, macular degeneration, and dry eye syndrome. New products coming soon. Embrace the science.
Good morning, I'm Dr. Kerry Gelb, and welcome to Open Your Eyes Radio. Please listen as I discuss the newest information in the world of health, nutrition, and sports every Saturday morning, 9 a.m. Central Time on AM 1280, The Patriot. Also, please share your thoughts by emailing me at drkerrygelb@gmail.com and visit my website at drkerrygelb.com. That's DRKERRYGELB. Vision is our most important and most complex of our 5 senses. Results from a 2019 UK study show that people would choose to live only 4.6 years of perfect health with sight rather than 10 years blind. Today's guest, Minnesota Optometrist Dr. Patrick Wellik, has dedicated his life to protecting and enhancing patients' vision and health. Dr. Wellik's awards include both the Young Optometrist of the Year and Optometrist of the Year from the Minnesota Optometric Association. Dr. Wellik is an avid athlete and helps young athletes enhance their vision. Dr. Wellik, thank you for joining me today.
Thanks a lot, Kerry. I appreciate it. I'm excited to be on.
So I want to ask you, as a biker and a runner, what do you think are the best contact lenses for bikers and runners? Let's start with bikers first.
I would certainly say, soft, disposable. We'll usually use daily disposable type lenses. They're usually the most comfortable lens that we can do. That's probably where, and that's the majority of patients we fit in our office anyway. Probably 80 to 84% of our patients would be in one-day disposable type contact lenses, soft contact lenses.
And sometimes when you're riding a bike, if you're not wearing protective sunglasses over it, the contacts could dry out and your eyes will start tearing. Do you have any secrets for that?
Again, a very well-fitting pair of sunglasses that would be wrapped. We're going to usually recommend polarized sunglasses in most cases would probably be the most helpful for most bikers, but certainly a good quality wrap that also fits very well. So some of the over-the-counter glasses maybe not fitting as well, and so again, a good fit with a good quality lens is extremely important.
And how about runners? Any tricks for runners?
Almost the same, really, Kerry. I would say I use an Oakley myself personally. I've used their brand if I'm going to throw out a brand right now. But many of the major brands have excellent sports types glasses that will help the athletes so they can perform to their highest level.
And what type of modality do you recommend? Do you recommend dailies, 2-week, monthly? What type of contact do you typically recommend for your patients? What do you think is the best way to wear contacts?
Yes. Again, I've been a very early adopter to the one-day disposable type contact lenses. Again, like I stated before, our practice is approximately 80 to 84% of our patients wear one-day throwaway contacts at this point. And most certainly they've come a long ways. The technology, the reasons, I guess I always tell patients, I've got 5 reasons that I look at of why I would fit you in a certain type of contact. And the first reason is always what is the ocular health? And not just short-term ocular health, Carrie, long-term. I'm not fitting this patient just for 1 week or 1 year or 2 years. Some of these patients may be in contacts for 30, 40 years. So that's a piece of plastic on that eye for many, many years. So, and by far what I've seen in over 35 years of practice, and I've seen contact lens on eyes every day of my life, the people that wear the one-day disposables certainly have the healthiest eyes long term. So the second factor we look at is what provides the most clear vision or best clarity. And again, because the daily disposable does not get as dirty and dry and deposited, so I teach my patients the 3D vision: dirty, dry, and deposits. If we can eliminate dirty, dry, and deposits, then we could probably perform better optically. And then the third reason would be comfort. What feels the best on the eye of that patient? We'd like to have that lens feel very comfortable for when they put it on in the morning. I hope they can just forget about it, not feel it all day long, and then just be able to throw away at nighttime. And then the fourth reason would be a reason why we fit contacts. It would be convenience. Certainly the dailies, because we don't have to do any cleaning, becomes more convenient in most people's busy lifestyles today. And then the fifth factor we look at is, what's the cost of the contacts? So, and I'll always tell patients, the cost of the daily disposables, it may be more, but what do you get? What do you get for that? What's the value proposition? And the value that people get from those other 4 factors of the best eye health, the best vision, the best comfort, and the best convenient will usually outweigh the cost at that point.
A lot of times patients will ask, when should they remove a contact lens? If they're walking around during the day and all of a sudden, when it's a definite time they have to take the contact lens out and either give their eyes a break or actually call their doctor and be seen.
Yes, Carrie, certainly, if the eye becomes more red, that can be a sign of some inflammation and or infection that we'd want the contact lens out. Certainly if they become much more uncomfortable to the eye, okay, more uncomfortable. And again, most of these daily disposables, they should, like I said before, should feel very good from, right away when they put them on in the morning till the end of the day. Or possibly too, if there would be a rapid decrease in their vision, where all of a sudden they're not seeing as clearly as they normally did.
And I want to circle back before about the wraparound sunglasses, the Oakleys that you mentioned, sports sunglasses. Any specific tint for any specific sport, whether it's golf or biking or hiking? Do you recommend a certain type of tint for a certain type of activity?
Yes, again, the technologies have progressed so much in the last few years to provide better types of tinting for different types of athletic activities. So I enjoy golfing, and again, there's certain tints that can provide much more enhanced vision on the golf course, and the same for many of the other sports. Again, skiing, running, golfing. So that's one thing we'll have the opticians in our optical discuss these different options and newer options with patients, because many of them have no idea that's available now.
I'm in Florida and my son plays ball and we practice a lot and I'm hitting him fungos and the sweat is getting into my eyes and it because of the salt, it changes the way my contact lenses fit. Do you have any recommendations for something like that?
Oh gosh, again, this God, what am I going to say on that one? Um, you know,
Is it more like I should wear a headband, or is it something as
oh,
simple as that, or
yeah, it's somewhat, hats, headbands, certainly to keep sweat out of the eyes. That's important. Yeah, because certainly that can sting and change the comfort of the contact.
how about any kind of drops? Like you recommend artificial tears for a situation like that, when for people who live in the South where it's very, very hot, we're seeing 100-degree weathers and people are getting sweat into their contact lenses. The salt is drying out the contact, or at least changing the shape of the contact lens. And people
Correct.
their vision is kind of being distorted. How about any type of drops?
Yeah, certainly that can be used too. So we'll usually recommend a preservative-free type teardrop. It's very important to know what type of drop should be used with contacts or without contacts. So some of the many of the over-the-counter drops are not approved to be used with contact lenses. So we want to make sure we're using the right type of drop with contacts. And then also, again, we're very, very adamant in our practice about using preservative-free drops. So we want less and less of the chemical going into the eyes, that we can. So,
Dr. Wellik, before we go into what myopia is and how we could control it, tell us about open door. What is that?
yeah, so at our office, our clinic, we have 4 doctors or 4 optometrists. I think we're up to 19 or 20 staff now, somewhere in there. And I've always let them, we always want to give back to the community. That's very important in our practice. And so I've let our staff choose how they want to do the donation. So they've gotten to choose what theme or where we want money to go on many of our donations. And our general theme is for food. And Open Door is a local pantry that helps provide food to those in need. And so we do monthly donations, and then we have also done work with we have an annual trunk show, and we take donations for that. We have some of the staff have worked in local gardens to help with just locally grown food. And some have volunteered down there too. So we've tried to give time, talent, and treasure to Open Door, a local food shelf operation.
So that's wonderful how you guys help donate so people in need get fresh and nutritious food. If they want to donate, people watching this, it's opendoorpantry.org. So they could donate and help people in need to get nutritious food. So Dr. Wellik, I want to ask you about myopia. So first, tell us what myopia is, and then we're going to go into how we could control it a little bit.
Absolutely. So myopia is the scientific term for what's called nearsightedness. And for what mostly happens in a nearsighted or myopic eye is a child's eye will start to grow longer, okay, and increase in what's called axial length. So the eyeball gets longer, and now the light that's focused in the eye is focused in front of the retina, and things that mostly at distance vision would tend to become blurry. And this can happen at a very early age, sometimes 6, 7, 8 years old. More likely maybe a little bit older, but many of the kids can have this happen at a very young age, especially if they had parents that are nearsighted too. So nearsighted is becoming much, much more common in today's world. I can't remember what the exact stats are, and Karen maybe even know better than I do, but basically at the rate we're going, and very soon 50% of the population is probably going to be nearsighted across the world. So it's becoming a very, very prominent problem and issue to us.
Yeah, I mean, that's a great point, because in 1900, 3% of Americans were nearsighted, and now 42%. And by 2050, they're predicting 60%. And as you said, about by 2050, 50% of the world will become nearsighted. So I'm going to ask you a tough question here. What do you think the cause of that is?
Oh gosh, well, a lot of people are going to say, is it the technology that's happening now? So, a lot is genetics, for sure. Uh, but I do think that things have changed most certainly for today's children. Okay. Um, being on much more screen time, we're trying to study this. Myopia is a very difficult thing to pin down exact causes, but we certainly know some things have changed with the amount of screen time for children and outdoor time. So with less outdoor time and in direct natural sunlight, we know that there's more progression or more issues with nearsightedness or myopia. So I never thought in my office I'd be telling young parents, you got to kick your kids outside to make sure their eyes are good. I never thought that happened in my lifetime. And now even things like sleep patterns are becoming very, very, very studied in this field too, to see hours of sleep and when is that sleep occurring. So and there's probably, I agree with you. I think there's probably some nutritional causes in there too. So many multifactorial, we call this.
When I was a kid, my mother used to yell at us to come inside. Now the parents are yelling at the kids, go outside and play. I mean, it's crazy. And I think you bring up a great point, because if one parent is nearsighted or myopic, that's 25% chance that their child will be nearsighted. If both parents, 50% chance that the child will become nearsighted. And there was a really interesting study, and I'd like for you to comment on this. They did a study with Sydney kids versus Singapore kids, and they looked at the amount of time that they were on a digital device. And the Singapore kids actually were on the digital device more than 3 hours. And the Sydney kids were actually on even more than that, but they were outside 4 times more than the Singapore kids. And so the Sydney kids, only 3% became myopic, and the Singapore 29% became myopic. So they were both on the digital device, about the same, maybe a little bit more with the Sydney kids, but they were outdoors 4 times as much, and only 3% became myopic, where about 30% of the kids in Singapore became myopic. And I just would like for you to comment on that. And how does that kind of make you look at things when you hear a study like that?
Yeah, it's nice. The one thing that's hard or been hard in myopia management areas is it takes a long time to do these studies. We don't do these in 1 or 2 years. This takes years of work to do this. So, but I think that evidence is becoming much, much more clear, and more studies about the amount of outdoor time that we do have to do, and provide our eye with the natural lighting for natural development. So we don't produce this length of the eyeball.
And what do you think as far as side effects of myopia, with increased risk of retinal detachment, myopic degeneration, cataracts, glaucoma? What do you think about, as the eye elongates, there's actually medical side effects to it?
Yeah, and that's actually what's changed in our office of being the ability to teach parents about this. Our ability to find the myopic child very early is going to help them later on in lifetime, when more of these ocular pathologies or ocular disease are more prominent. So, and again, the studies are showing that the increased risk of some of these problems later on in life are much, much greater in the nearsighted patients. So, and I've told my staff, I'm getting more towards the end of my career, Carrie, being at above 60 now. So, but one of my goals here in my last years is to try to help with finding these kids and help with myopia control. So, because that's the main reason we're doing this, is to help the child's long-term eye health.
And you look at what you said before about digital devices. The American Academy of Pediatrics, under 18 months recommends no screen time. and between 18 months and 2 years, limited amount of screen time, not until they're over 2 to 5 years, a 1 hour max. So screen time seems to be something that being outside seems to be something that helps decrease the risk. And screen times, it seems like the experts are agreeing that increases the risk of needing glasses or becoming nearsighted.
Totally agree, Carrie. Totally agree. So, and it seems kind of sad. It's like, what do we do? You know, these kids are so young. What's the first thing we do? We hand them an iPad to keep them pacified on things. Is that, and I tell the parents of these patients, is that the right thing to do? I don't know the answer yet, but I certainly I don't think so. So, and I think as we get more and more of these studies, you know, the field of myopia management is still pretty young, actually. I guess I've always told people I've been doing orthokeratology for many years, over 20 years of orthokeratology, but I find that my clinic switched things over to talking about more myopia management now, and the reasons why I'm doing it again are for the health reasons of the children. So when I was doing the orthokeratology many years ago, I didn't know I was trying to help patients' eyes. I was just trying to help them see better without glass or contacts. It was actually helping the health of their eyes.
I mean, that's a great point. And if we look at ways that we could decrease myopia, you mentioned orthokeratology. The soft lenses are a way of doing it now. Let's start with orthokeratology. Tell us what that is and how can that help us manage myopia?
Yeah, so this is the method of treatment that I'm most familiar with and again, have the most experience with. Again, the soft lenses came a little bit later. So what happens with orthokeratology, we use a gas permeable contact lens that can reshape the front surface of the eye and refocus light differently inside the eye. So there's differences whether the light inside of our eye focuses on the center part of the retina or the edge of the retina. And there's some differences in the way this focuses will promote the eyeball to lengthen. So again, what our job to do is to try to stop that eyeball from growing longer. And with these special overnight lenses, it'll change the shape of the front surface of the eye so that we can get more of the focus in a different spot and prevent that lengthening. So these kids wear the lens, it's the reverse. It sounds kind of crazy, but we actually have the lens worn at nighttime, you know, very similar to a dental retainer. And then in the morning, they can take these lenses out and then they clean them at that time. But the beautiful thing about that and the huge advantage I like is most of the patients don't have to wear any type of correction during the day then.
Hold that thought. We only have about 7 seconds left to the break. I'm with Dr. Patrick Wellik. This is Dr. Kerry Gelb for Open Your Eyes Radio. We'll be right back.
MacuHealth, your science-born and tested solutions for visual performance, macular degeneration, and dry eye syndrome. New products coming soon. Embrace the science.
We're back with Dr. Pat Wellik of Minnesota. He's Minnesota Apple Valley Eyecare in Minnesota. He's giving us some great tips on myopia and nearsightedness, how to prevent it, and what to do if you're going to get it, and reverse it or at least slow it down. So at the break, we were talking about orthokeratology, where we're using a gas permeable type of lens, which is like a harder lens back in the old days. And people sleep with it at night and it gently reshapes the eyes, and the kids take it off in the morning and it decreases the progression by about 70%. There's been a lot of studies on this. And tell us a little bit about maybe a case that you had or a patient that's done it. I know I do this quite a bit in my office and I've had some great success stories with kids, but tell us about somebody that maybe stands out in your mind of a success story.
Yeah, one I think of, and there's some good things on this side of the story, and there's some bad things on this story, but I want to share both actually, because it's been very learning to me. So there's a young patient, and her father was a pilot, but he was a very high nearsighted patient, about a -7 for those of you familiar, but that's fairly high nearsighted patient. And the mother was a little bit lower nearsighted. So both patients were myopic. And they brought her in. I think it was she was 11 years old at the time, and the father was very interested in trying to prevent getting nearsighted like he was. So he understood very well what could happen to his daughter's vision. So we went through the options, and he did elect to do orthokeratology, the overnight gas permeable lens. So, and at the time that we saw her at 11 years old, she was probably like a -2. Okay, so lower nearsighted. We were trying to keep her at that level and not progress. So fast forward, she stayed with me. She was a local patient for many years, even through college, up until age 22. And we had done 11 years of orthokeratology with what's called the CRT, or corneal refractive therapy lens, and was very, very successful. So, and then at age 22, and she had not changed or advanced very minimally over that 11-year time period. So at age 22, she had asked about maybe going into a soft lens. Okay. And I was a little bit nervous because I thought maybe her eyes could still be changing. So I tried to convince her to stay in the CRT lens. She opted against it, and then she got fit in just a regular soft lens. So, and then within 3 months, her prescription started to change, and to get more nearsighted. Within 6 months, it had gone from a -2 to a -350. Within a year, she had probably been up to about a -4. So she doubled her prescription in less than 1 year after we had kept it stable for 11. So that just a story of success and a story of learning about what this therapy can do.
I mean, Ortho-K, or CRT, corneal refractive therapy, really has done some really great things for people. I've seen people, because it was approved around 2002, 2003.
2003.
You know, and I have patients from 2003 that are still using it. I have one patient who's a physician now, and she was a little girl, and now she's a physician, and she still uses it and loves it. But I have hundreds of patients, I'm sure, like yourself. But let's move on to soft lenses. Now there are soft lenses that could slow down myopia. So rather than wearing a gas permeable lens, which may not be as comfortable, and you have to take it off in the morning and be able, and you can see good, this time you're just wearing a soft lens to slow down the myopia. So tell us a little bit about that.
Yeah, so MiSight was developed, and it's being marketed with CooperVision. It's been a great help to our success with myopia management, because there were many people who either were intimidated by a gas permeable lens, or maybe they just couldn't handle that type of lens, or maybe there were some discomforts. So there were some hurdles. We had very good successes with many patients with the overnight gas perm orthokeratology, but it wasn't for everybody. So now with the advent of the MiSight lens, that has really extended our range of patient that we can fit. And I feel too, Carrie, that the younger patients actually have probably done a little bit better with that sometimes than with the orthokeratologies. We're very happy because we do want to catch these patients as early as we can in the process.
So MiSight, explain what it is. What type of lens? Is it a daily? Is it a weekly? Is it a 2-week, monthly? And how does it work?
Yeah, so it's going to work almost the same way as the orthokeratology. Again, it's a different way that light focuses inside the eye. So it looks like just a regular soft lens, and it is a 1-day throwaway again. So we like the idea of the daily disposable for the health, the comfort, the convenience, and the vision. So it is a 1-day throwaway, but again, it's made or manufactured differently to have a different way that light focuses inside of our eye, so that it decreases the ability of the eyeball to lengthen over time.
And do you use any instruments in your office to measure the length of the eye to see if it's getting bigger? as they're wearing these type of lenses?
Yeah, I think that's the most important thing we have to measure over time, in my opinion. I think to be an expert in this field, I think we need to measure this. I know there's some arguments in and out of optometry. Should we measure this or not? So, but we've got what's called the topographer that'll measure the shape of the front of the eye, but it also now we have different functions that can measure the length of the eyeball. So we do that at every visit. We'll see these kids normally every 6 months to measure the length, and it's a great tool to help the parents know too, is this therapy really working or not? So, and to us too now as practitioners.
Yeah, I agree. I mean, we use something also to measure the length of the eye. And I think if you're going to get involved in something like this, it's important that you do measure the length of the eye to see what your progress is. Is it working? Is it not working? Whether you're using MiSight, which is a soft contact lens that slows the progression. And I think the statistics about it slows it about 70% as well, will slow the progression. Or you're using Orthokeratology, like a Paragon type of lens, which will also slow the progression, but do it in a different way where you're sleeping with that gas permeable lens at night and then taking it off in the morning and being able to see. Are there any other instruments that you think are critical for somebody that's a patient is going in to get their eyes examined to see if they're nearsighted or myopic, that they should have, or that you do in your office?
Yeah, and again, we've got, we try to keep up with technology very well. So even the instruments that are going to help us detect the diseases later on, we try to institute as early as possible. Wide field pictures of the inside of the eye and the retina, photographs and measurements of the optic nerve size and shape. There's many different ways now to measure eye pressure. That should be done at every exam. So there's a host of visual health things that are probably done at most exams and maybe sometimes not explained to the patients properly. But we make sure the patients understand that we're doing a very comprehensive eye health exam and the importance of that. So, technology and procedures, consistent procedures too. That's what's very helpful too, Carrie. If we can get people coming in once a year for their annual exams, it's much easier for me to follow and know, are there any health changes going on? If I see that patient maybe once every 4 or 5 years, it's more difficult to tell if there have been changes to the ocular health.
That's a good point about annual exams, because, people now are going on their cell phone and getting their eyes examined, their prescription examined by their cell phone or by some digital device, rather than going in to see an eye doctor like yourself. What's the pros and cons by doing it on the cell phone as opposed to going in to seeing the eye doctor?
Yeah, it's very important to get that relationship built with your eye care practitioner. Extremely important. And I'm going to just use my health example again. I told you I'm at 60, so my doctor here in Apple Valley I'd been with for many years. He moved on to go into the Mayo Clinic system and moved away from Apple Valley. And I tried to work with another doctor for another period of time, and nothing against that doctor, but it was not the same. And so I end up following my doctor, who's probably now 50 minutes away, but I don't care that he knew me. He knows me when I walk in. I don't have to review my whole story with him. He knows how I feel about things. So that I think that personal relationship is extremely important. Especially in today's world, where we've lost a lot of that in the cold hard world of, again, technology and again, a personal relationship with an eye care practitioner is almost more important than, again, all this technology we talk about.
Because when a patient's sitting in front of you, you get a big feel for the patient. You refract. You're doing prescription. Refractions when we're getting a prescription for either contacts or glasses, and we do a lot with our ears. We could see the way the the facial expressions. The patients will tell us things, and many times that we can help them with their general health as well.
And again, the on the phone refractive technologies, again, they still can't think. They haven't, these things can gather data, and sometimes they're accurate, sometimes not accurate. So yeah, they don't think, they don't discuss, they don't help you troubleshoot. So yeah, obviously we're here to promote the annual exams, so important. And again, I tell patients all the time, I hope we come in here and sometimes nothing happens. That's okay,
So we talked about soft contact lenses, a brand that's FDA approved called MySight. We talked about gas permeable lenses that people sleep with at night, and they wake up in the morning and they take off the contacts. Both of these modalities decrease the progression of nearsightedness by about 70%. We know that as people get more nearsighted, they have a greater risk of myopic macular degeneration, cataracts, glaucoma, retinal detachment. So we don't want the eyeball to expand. We want to try to slow it down. So there's another way of doing it, and that's with drops, and it's atropine drops. Atropine's been around for a very long time, and it's very low dose atropine. So Dr. Wellik, what's your opinion about using atropine, and where would that be on your pyramid of most important to least important? And if you had a younger child or a grandchild, now that you're 60, although you don't look a day over 40, if you had, would you put them on atropine first, or would you go more to a soft contact or the gas permeable type?
Yeah, great question, Kerry. So that is definitely in our clinic, our third choice for myopia management. So again, we're primarily probably CRT first in most cases, MySight soft lenses number 2, atropine trailing at number 3 for sure. So yeah, atropine, it's old dilating drops. So some of the people that are old enough maybe had some atropine in their eyes to dilate the pupil to look inside the eye. And again, like you said, we use very low dosages of this. And we're not quite sure of the exact mechanism of how this works to slow down the myopia, but it does work, but probably to a much lesser degree than what we do with the other two modalities for sure. So I've got some patients on it. Again, if some patients have read about this and want to do it, again, we got to be a little careful. Some kids do get a dilated pupil, or they could have a little bit of problems with their near vision or reading vision when they do this. So there's a few side effects, but the parent will put a drop in like at nighttime, at bedtime, one drop in, and then it essentially does try to slow down that lengthening process. Again, we're not quite sure why. So, but I'm very interested to see, Kerry, what will happen with any combined therapeutical help along with the other two modalities.
I think a combination is probably a great idea, whether it's combination of gas permeable and MySight, you get hitting them with both, which not too many people are doing, or maybe adding in the drops. But, you always, whenever you're going to put someone on these drops, they're going to be on a kid for a long time. So it's something that I know for me, I'm talking for myself, something I have to think really hard about. If I want a kid, even though it's a low dose medication, do I want them on one of these drops for a long period of time? Or would it be better to put them in a soft MySight type contact lens or a gas permeable CRT type contact lens? And that's a discussion between that us as doctors have to really talk to the parents about, and and see what would be the best for the kid.
Yeah, very, very much in agreement, Kerry. Yeah, I'm in the exact same camp. So again, it does take a long time to study these things. So, and then again, even with the studies, most practitioners need to convince themselves and do it personally and see how they feel about things too. It's one thing to read it in a study or hear about it from other doctors. It's another thing to do it on your own patients. So.
And something else that's coming out for myopia control, they're going to be spectacle lenses. I know Essilor has one, and some of the other companies have one. And is that something, that you've looked into, and have you thought about these type of spectacle lenses?
Oh yeah, I will welcome that handily. So, and again, that just expands our ability to be able to treat more of these patients earlier. Again, some of these early kids that can't do a contact at all, or might be afraid of an atropine drop, or if the parents would opt against an atropine, glasses are going to be wonderful. So yeah, I can't wait till that gets approved. I know it's again approved outside of our country. We're always a little slower to get things adopted here in the U.S. Because of our FDA, but yeah, I can't wait to see what that does too, because that will really open more of the floodgates. And I think one of the problems with myopia management too, Carrie, is the public doesn't know about it. I'll get these patients that'll have MiSight, or especially orthokeratology lenses, and the parents will be telling other parents sitting at a ball game or something, "Hey, how's your kid not wearing any glasses or contacts now?" And not enough people know what this is about yet. So getting the public awareness out there is huge for us.
There's other specialty contact lenses now, like multifocal daily contact lenses for astigmatism that are daily lenses for, I think we are in agreement that daily or single-use contact lenses are the safest, the most convenient, and the best way of wearing contact lenses. And really the companies that manufacture contact lenses, that's where they're putting their R&D into these type of lenses. So if you could comment a little bit about contact lenses for people over the age of 40 who are presbyopes, who lost the ability to focus, but now they could wear contacts, and they could even wear single-use contacts.
Oh yeah, wonderful things again. And again, we're so happy that it's available now in one day lenses. So yeah, so everybody, around upper 30s to low 40s is going to start to lose some of the focus ability of the eye, called presbyopia, and needs some kind of reading correction, most likely, by the mid 40s for sure, usually. So, the ability early on, multifocal contacts were very difficult to manufacture. They just didn't provide very, very good quality visions. So most people were, and again, lots of people are unaware of it, first of all, but many people were unsuccessful. So those people can easily be fit many times with some of the new lenses. The companies have really amped up their game to be able to provide great lenses for this type of population. So, and again, the other thing, I think people shouldn't be afraid to try lenses at a later age. I get many patients come in, Carrie, and they'll say, "You know what, I'm too old for contacts." I say, "No way, I've got ladies in their 70s wearing one day throwaway contact lenses, very successfully." So there's never an age range where you can't wear contacts anymore.
Yeah, and I from experience, I think when you wear contacts, people should wear a contact from the big four, the big four manufacturers, whether it's Cooper Vision or Alcon or Johnson Johnson Vision or Bausch and Lomb, rather than some of these contact lenses that are manufactured overseas. I'm finding that patients don't get the same amount of oxygen, safety, and vision. I don't know if you have found the same thing.
I totally agree. Totally agree. Number one, we want to be everything above board legal, first of all. And again, protecting our patients too. That's our number one thing. Like I said, like I told you before, I tell patients, this is a piece of plastic on your eye that's going to be on there for many years. We need the top level safety that we can have. The lenses that we provide to them are all FDA approved, and very proven, successful over many practices like yours and ours. So totally agree with you.
And I just want to switch gears real quick. Diabetic eye exams. That's something that you have on your website. Tell us about the importance of diabetics getting their eyes examined.
Yeah, so diabetes, kind of the main thing that happens is, just to really dumb it down to the basics, is the tiny blood vessels inside the eye and the retina can become very leaky. and they'll bleed, okay? And then that can leak blood and other fluids and other spots of the retina that we don't want. This is called diabetic retinopathy. And, it can be extremely common as the A1C or the blood sugars get higher and higher. So if you have uncontrolled diabetics, this can become a very serious problem for them. So they need to be seen annually for sure. They should be educated with their primary care physicians that this needs to be done, and in our offices too, to make sure we take very, very close care of monitoring annually for the diabetic retinopathy.
Well, I want to thank Dr. Patrick Wellik for joining me today from Apple Valley Eyecare in Minnesota. If people want to find out more about you, Pat, how could they do that?
Yeah, so our clinic again is Apple Valley Eyecare, and we're in Apple Valley, Minnesota. Our phone number 952-432-0680. You can find us on the website again at applevalleyeyecare.com. And I enjoyed doing this, Carrie. Hopefully this is very helpful to other people, but I enjoyed it very much.
I want to thank Dr. Patrick Wellik for joining me today. This is Dr. Kerry Gelb for Open Your Eyes Radio on AM 1280, The Patriot. See you next week.
Your eyes and your vision are under attack, damaging blue light from the sun. Your phone, your computer, your tablet, even light bulbs and car headlights is constantly bombarding you. The good news is our eyes actually already have a line of defense to counter the effects of blue light. This defense is made up of 3 pigments called carotenoids. MacuHealth with Micromicelle, the only supplement with the exclusive patent on all 3 macular carotenoids and Micromicelle technology.
Fitting multifocal contact lenses presents a big opportunity to meet patient needs while growing your practice. Alcon is your partner not only with our innovative portfolio, but through e-learning. Learn to enhance your multifocal strategy today with the Alcon Experience Academy.
OIE Broadcasting is the emerging leader in social media. We use scientific entertainment to drive more patients into your office. Visit oiebroadcasting.com and sign up today.